Amoxicillin is an antibiotic used commonly to treat bacterial infections in kids, such as an ear infection. But last month, the Food and Drug Administration placed that medication on its drug shortage list.
Yeah, and now some parents are noticing that shortage. So I reached out to pharmacists across the Treasure Valley today to find out just how big of a problem this is right now.
Amoxicillin is a medication that we will use to treat a community-acquired pneumonia. We'll use it to treat a strep throat infection. We can use it for otitis media or an ear infection. We also use it for prophylaxis for a number of patients.
And the need has only increased recently with more people getting sick. Tyler Osgood is the St. Luke's Pediatric Pharmacy System Coordinator. He says recently they've seen a pretty significant shortage of amoxicillin.
It's something that it really kind of impacted us at a pretty rapid pace.
And they're not the only ones. KTVB reached out to dozens of pharmacies across the Treasure Valley, including pharmacies at Albertsons, Fred Meyer, Walgreens, and Ridley's. All of them say they are experiencing that shortage, but some pharmacies have not yet run out of the medication. And if they have, they told KTVB they are substituting it with another prescription or asking doctors to adjust prescriptions in order to treat children. Walgreens also sent KTVB this statement, which says, although demand for amoxicillin has increased, Walgreens is still able to meet patient needs at this time and will continue to work with our suppliers and distributors throughout the season to best serve our patients. So what's behind this shortage? Osgood says that's a tough question to answer.
There's a multitude of different things that can affect the availability of medications. There could be shortages in raw ingredients that manufacturers are using to produce the drugs. There can be shortages in equipment that's used to support the drug, the medications.
And with the heightened RSV cases, more parents are trying to get their hands on amoxicillin. So what does this shortage mean for parents?
It might be a situation where we're calling around, and that's something that we can help when we're prescribing these medications. So we're actually working right now at St. Luke's in tandem with our infectious disease specialists to come up with all of the alternative therapies that we can use to treat different infectious disease processes that we're seeing in our pediatric population. We don't only have amoxicillin in our armamentarium of medications.
And Osgood wants to stress that while there is a shortage, there are alternative therapies out there for treatment. And he adds there are very few instances where amoxicillin is the magic bullet for a particular bacteria. And today, while I was calling various pharmacies, some also told me they're seeing a shortage in Adderall, and some stores are also seeing a shortage in medications like children's Tylenol.